All right, guys. Howdy. Happy Poop Tip Tuesday. Hope you guys are having a great Tuesday as well. We have a great show today. 3 main topics. Number 1, what food should you avoid if you have IBS? Number 2, what is diverticulitis? Have you ever wondered what that is? Comment down below and let me know. And number 3, Whipple's disease. What? Yes, a rare disease that you guys asked for. That and more, and your live questions on today's Poop Tip Tuesday. Guys, let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, I am ready to get started. So if you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. Every other Tuesday, I go live on my social media channels to answer questions you guys may have about gut health, general health, whatever, anything you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to let me know where you're watching this at. I love to hear my audience. Are you watching this live or on the replay? And also where you guys are watching this at as well. Hope you guys are having a great summer. Do you guys have any plans for the summer? We don't have any big plans. We're not planning on going anywhere right now. My kids are involved in a lot of camps, whether it's golf camp or tennis camp or anything else like that. So we have nothing going on. But let me know in the comments down below if you guys are going anywhere. Maggie, good seeing you. Thank you for watching from Michigan, and you got it diagnosed with diverticulitis. Well, guess what? We're going to talk about it today. Raymond's good seeing you. Thank you for watching from Idaho as well. Rosina, good seeing you as well. Thanks for watching from Australia. And Christina, thank you for watching from here in good old Lubbock. I clean this off there. Perfect. Sounds good. All right, what's going on in my life? So number 1, you may have seen on my newsletter, we have an infusion center in our office. Yes, I'm so excited. We're able to do infusions for our patients who have autoimmune diseases, whether it is rheumatological diseases, neurological diseases, and also inflammatory bowel disease. But we also have health infusions as well. So if you're feeling like you need a immunity boost, you need to improve your gut health, you need to get some hydration, feel well, we have that option for you. If you want to learn more, go to my webpage, subscribe to my newsletter. You can get more information on that as well. No other big news. I am reading a couple of books now. Number 1, still on my John Grisham phase. I just finished The Rainmaker last night. You may have seen this in the movie. It was a movie with Matt Damon. I thought it was pretty good. The book is not bad. I actually quite enjoyed it. Last time I was on my Poop Tip Tuesday, I talked to you about the PayPal book, which I just finished last week. And now I'm reading Code Breakers. This actually is a really good book. Walter Isaacson, I don't know if you guys have seen his books, but he's done a lot of famous books. He did Leonardo da Vinci, wrong one. He's done books on Einstein and other people as well. He's a great writer. Code Breakers is a really interesting book about how some of these scientists, the ones who've won the most recent Nobel Prize, are able to change the genetic code. I'm fascinated by these books. I don't know why. I have an interest, maybe because I'm a big old nerd. But let me know in the comments down below what you guys are reading. Any tips for me, any recommendations for me, anything you think that I would be interested in reading as well. All right, as usual, I'm going to go through 3 questions that you guys have sent me. And if you have a question, let me know in the comments down below. So question number 1, what foods do I recommend if you have IBS or irritable bowel syndrome? Let's talk about this. So what exactly is IBS? So IBS is a condition in which your body reacts to either food, stress, or what's going on in the environment to cause a change in your bowel habits or bowel caliber that's associated with abdominal pain. And IBS is such a common condition. There are millions of people out there who suffer from IBS, and it can manifest as multiple different symptoms, whether it's diarrhea, constipation, maybe pain, bloating, maybe all the above. Let me know in the comments down below if you know anybody who's had IBS or if you suffer from IBS as well. Now, what exactly are the triggers for IBS? We don't really know about one particular trigger. there may be multiple different triggers that are involved. Whether it's maybe you got some sort of gastroenteritis, and then after that, your gut has not been the same after that. Maybe you've taken some antibiotics for a different condition, and since then, your gut has been out of whack. Maybe certain foods that you eat that could be a trigger as well. It could be the stress going on around the life and around the world that's causing your stomach to act up. Maybe it's your gut microbiome. It could be food intolerances. It could be any of these or all of these, or for some people, it actually may be a genetic component going on. We don't exactly know. For many of my patients, it tends to be multifactorial, multiple different causes. And that could be the difficult thing when it comes to IBS. So how do we treat this? There are a lot of different ways that we can treat this. Sometimes it's foods, and I'll talk about that. But sometimes it's medical therapy as well. The thing I want to tell my patients and everyone when it comes to IBS is that there's not one size fits all. So for some people, eliminating the food may be enough and they're doing great. But for others, they may need medical therapy. They may need psychological help. They may need a change in the gut microbiome. They may need everything to get them feeling better. So I don't want you to feel like just because you've changed your diet and you're not better that you're a failure. No, that is the natural course of how IBS is. So getting into specifics, what are the foods that I recommend? So in reality, there are three main foods or three main diets that have been shown in clinical trials when it comes to IBS. I'm going to go through each single one. Number one is a gluten-free diet. Okay, I know you guys have seen the fads and the information on social media and things on the internet when it comes to a gluten-free diet. Let me know in the comments down below if you've heard of this or you've tried this. But in essence, there are a lot of individuals that have an intolerance to certain wheat products, and there is some evidence to suggest that eliminating gluten can actually make you feel better. This tends to be one of the more popular diets that are out there. Now, when it comes to the science, it's okay. We don't have a lot of good evidence that eliminating gluten is going to be the cure-all when it comes to IBS. Number two is that it can also be very hard to live a life without gluten, especially if you don't have an actual autoimmune disease against gluten. Gluten's everywhere. I love bread. I like to have rice. It would be hard for me to go on that. And number three, just because you avoid gluten, you feel better, doesn't mean that you have an actual gluten intolerance, because this leads to diet number two, FODMAPs. FODMAPs are certain foods, certain carbohydrates and sugars that are known to produce a lot of gas, bloating, and distension. And so we have patients go on what's called a low FODMAP diet, where you eliminate all these foods that tend to trigger a lot of gut issues. And we have a lot more evidence for the benefits of a low FODMAP diet. And in fact, this is the reason why patients or people, when they avoid gluten, they feel better, because gluten is considered a FODMAP, a food that's high in these fermentable carbohydrates and sugars. Now, a low FODMAP diet tends to be the standard treatment for a lot of our patients who have IBS. Here's the issue with that diet. It is so hard to do. You have to restrict pretty much all the foods, and over the course of a couple of months, you have to start to reintroduce those foods back in again. It is hard, it is time consuming, and it's best done with a dietitian. It is a hard diet to do. And for a lot of my patients who do this, they feel better, but they understand that it can be a significant lifestyle change. So what is the other diet that I recommend? This is the one that I recommend for a lot of my patients. We're seeing a lot more studies on this being beneficial. It's called a traditional dietary advice. It's pretty simple. And there are a couple of simple things that you can do today to improve your IBS. I'm going to go over them right now. Number one is to have a regular meals. Too many of us may not have regularly scheduled meals. It's important to have regular meals when you have IBS, to have a consistent meal pattern. Number two, you want to eat where you're never too full, and you never want to be too hungry at all times, meaning you don't want to engorge yourself with so much food, but you don't want to eat beyond where you're going to feel comfortable. So the best analogy I have, let's say 5 is where you're stuffed and over full, and 0 or 1 is when you're starving. You want to be at 3. That's where you want to be. You want to be enough where you're satiated, where you eliminate the hunger, but not so much where you're overstuffed. Number 3 is that you want to make sure you have adequate hydration. Drink enough water. Drink a lot of water to get you feeling better and to get you feel fuller. Number 4, there are certain foods you want to reduce. Number 1 is caffeine. Number 2 is alcohol. Number 3 is fizzy drinks. I didn't say eliminate. I said minimize or reduce that. You also want to reduce processed foods, fatty foods, and spicy foods, because these are known triggers when it comes to IBS. Next is you only want to keep fresh fruit to a maximum of 3 servings per day, and that's it. Don't go any more than that. And then lastly, you want to minimize the gas producing foods, things like beans, lentils, some breads, and artificial sweeteners. You also want to minimize the amount of dairy that you can as well. And then lastly, you want to increase as much as you can the amount of soluble fiber. I have found that for my patients, these simple steps tend to eliminate a lot of their IBS issues, get them feeling better. It's cheaper, it's easier, and works. Now, it is worthwhile to consider doing a gluten-free diet or even a low FODMAP diet, but I would do that as a second-line diet after you've eliminated these simple things, and if you want to go down that route. But these are my recommendations when it comes to diet, when it comes to IBS. Let me know in the comments what you think, what have you tried, what worked, and what hasn't worked when it comes to particular food issues for IBS. All right, let me see here. Cindy, thank you for watching from Canada. Enrique, thank you for watching as well from San Diego. Deodad, I don't know if I'm saying your name right. Thanks for watching from Tampa. Enrique, good question. We'll answer that very quickly. Thank you for, oh, I love your video. Yes, thank you. Thank you. Cindy, we'll answer your question as well. All right, perfect. All right, so let's go through some of these questions really quick. So Enrique asked, acute gastritis, how long with a proper diet and PPIs before it to heal? It's a good question. What we typically recommend is usually about 8 weeks, so 2 months. So 2 months of consistent use of an acid medication and 2 months of consistent use of dietary changes should be enough to heal what's going on. And so usually we say 2-month trial to see if that will be enough to heal up your gastritis. If it's not better after 2 months, you may want to consider other reasons why you're having the issues, and make sure you want to eliminate any of the insulting problems that's causing your gastritis, whether it's anti-inflammatory medications, whether it's smoking, whether it's certain foods. But that's typically what we say is about 2 months for that. All right, next question, diverticulitis. What is it and how do I treat this? Let me know in the comments if you've had issues with diverticulitis. I know other people have. So diverticulitis is inflammation of some of the pockets of your colon. In the vast majority of us, about 40% of the US population have these pockets in their colon called diverticulosis. These are small little pockets in the colon that are typically there as a consequence of constipation or as age. These are not a big deal. Don't do anything for these. Don't avoid things like seeds, nuts, popcorn. There's no evidence that makes a difference whatsoever. It is natural to have diverticulosis, but sometimes these diverticular pockets can be infected with stool, and over time, like anything that's infected with stool, it can become inflamed. That inflammation will cause pain, fever, chills, and sometimes bleeding. And this is when we suspect someone to have diverticulitis, and that's exactly what it is. So how do we diagnose diverticulitis? Now you may think you can diagnose this by, I have these symptoms, that's all I need. Or you may think, I feel pain, that's what I have. No, no, no. The only way that we can diagnose diverticulitis is with a CAT scan. This is why it's very important that you get a CAT scan when you feel like you have diverticulitis, because there are a lot of other reasons why people can have pain in their belly. It may not be diverticulitis, and I do not want to give you that diagnosis, nor do I want to treat you with the medications that we have that are pretty powerful unless I know for a fact that you have diverticulitis. But the only way for us to know this is to get a CAT scan. So if you feel like you have diverticulitis going on, it's imperative for you to go ahead and get a CAT scan. So how do we treat an acute episode of diverticulitis? Well, we give pretty effective antibiotics. Typically, we give 2 antibiotics to help control those symptoms. We give them for about 10 to 14 days, and we make sure the inflammation has gone down and that my patients are feeling better. Now, here's the issue with diverticulitis, that we need to find out why. Why do you have that? Because even though we know the most common cause is a piece of stool getting stuck in that pocket, there are other reasons that we worry about. It could be a sign of inflammatory bowel disease, whether it's Crohn's or ulcerative colitis, or it could be a sign even of colon cancer as well. So after we treat your diverticulitis, we typically have to do a colonoscopy about 8 weeks later to confirm there's no other reason for you to have that, to make sure your colon is clear and to make sure everything is doing okay. Now, the big question people ask me is, hey, Dr. Islam, how do I prevent diverticulitis from happening. Here's what you need to do. There are 5 things that I recommend. Number 1, you have to stop smoking. If you're smoking, you need to stop. There's excellent evidence to suggest that smoking will increase your risk for developing diverticulitis. So if you're smoking, stop. Come on, guys. It's 2022. Smoking sucks. Don't do that. Number 2 is that you need to avoid some of the medications that can cause diverticulitis, specifically non-steroidal anti-inflammatory medications. Aleve, naproxen, Advil, Motrin. These are medications that are known to cause irritation in the colon to cause diverticulitis to occur. Number 3, you need to increase the amount of fiber in your diet, especially soluble fiber. Fiber will bind the stool, make it easier to pass, make it easier to go through, and can decrease the risk of inflammation. Number 4 is that you need to minimize the number of red meat items that you're eating. I know this is hard. Listen, I'm from Texas. We love our meat. But in order for us to decrease your risk for developing diverticulitis, we need to decrease the amount of meat that we're eating. We are seeing such good evidence that a diet that's high in meat can increase the amount of inflammation inside your colon and cause inflammation to occur. And then lastly, the last thing is that you need to have a wide variety of plants and vegetables. This will provide the antioxidants, it'll provide the fiber, and it'll provide the nutrition to make sure you don't have to worry about diverticulitis. What you don't have to do at all is to avoid things like seeds, nuts, popcorn. It's a very common wives' tale, very common myth. Don't worry about it. If you love popcorn, go nuts. I give you permission. All right. Maggie, I just bought that book, Sparring Partners, so I appreciate you giving me that recommendation on that. Thank you for that. So Khalid, yes, I am live if you have a question for me. So yes, Tuesday, Mari, you're exactly right. FODMAP does suck when you have to do it. It is hard. I agree with you. And then there's another question here about onions. So do onions make you go? 100%. So onions are actually part of the high FODMAP diet. And actually onions may be a reason why you're having so much bloating and gas and IBS issues as well. So absolutely. I know we all love onions, but onions is a very big trigger when it comes to IBS issues. It's one thing we probably would recommend for us to stop. All right, next question. Dr. Islam, I've heard about Whipple's disease. What is it? This is a good question. It's a very rare disease and a very rare condition. And so I'm surprised that somebody actually asked me about this. But what this basically is, it's a very rare bacterial condition that can affect pretty much your whole entire body. It really does affect the guts, your GI tract, your joints with arthritic pain, and sometimes neurological issues. And it's that triad of 3 things in the right individual that'll give us the clinical clue that you have what's called Whipple's disease. Now, this is due to a bacterial infection, and what we don't know is that we don't know a lot about this particular bacteria. It's called T. Whippelli. Oddly enough, Whipple's disease, yes, it makes sense. We don't know how people can get this bacterial infection. We don't know exactly how it can affect the body. We do know that it does affect the lining of both your colon, it can affect your joints, and it can affect your neural and your brain in terms of causing neurological issues. So what are the main symptoms from this? So number 1, I mentioned gut issues. Sometimes it's going to be diarrhea, poor appetite, change in bowel habits, something else that's going on there. But also in that combination of joint pain as well, you can have new onset joint pain where you start to have arthritic issues that you didn't have before. And then over time, it also causes neurological issues, whether it's altered mental status, seizures, behavioral changes. And once again, it's that triad of symptoms that is very unique that allows us to diagnose somebody with this. And there are various ways we can diagnose this. And it's very important for us to diagnose this early because it can lead to people dying, unfortunately, an untimely death. And so I've only seen about 2 cases in the 10 years I've done GI. And these were cases that we were like kind of had that weird little triad in the right patient. And it did take some investigation to find out if that is the case. All right, guys. I don't see any more live questions. Do me a favor, if you can do me a huge favor. Number one, let me know what you guys think about this format. I'm thinking about changing it up a little bit, so let me know if you guys want me to do that or not. Number two, if you can let me know if you're watching this live or on the replay. And number three, if you can let me know where you're watching this at as well. I would love to hear where my audience is coming from. But I want to thank you guys for watching. If you have any more questions, put them on the chat. I do this every other Tuesday, so in 2 weeks I'll be doing my live channel as well. Send me some questions, send me whatever information, topics you want me to talk about as well. I want to thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. If you feel like somebody would benefit from this video, I would appreciate it if you send them the link to this video and have them subscribe to my channel as well. Hope you guys are doing well. Stay safe. I'll let you know my updates on my books. Oh my gosh, this is so heavy. I'll be reading. I'll let you know what I think. And let me know what else you guys want me to talk about. Thanks, guys, and take care. Bye-bye.